Good afternoon, everyone. Please bear with me as we kind of go through this, and I'll try to explain as much as I can along the way. So we're looking at the approach to quality and just kind of an overview of the cross-episode approach. But basically, by design, the episode model is created in order to incent high-quality care, and it incorporates two types of metrics into that. The first type of metrics is your quality metrics that are linked to payment, and then also you have quality metrics that are for reporting purposes currently. So those are both going to be in your reports, so when you receive your performance reports, you'll be able to look at both types of those quality metrics regularly as you get those reports. And it's a good idea to look at those because that's a good way for you to look at your performance in terms of your peers, and also to look at that and make practice adjustments or program adjustments as you go along, both for the quality part that is linked to payment as well as the quality metrics that are linked to reporting. There's some limited metrics that are possible through claims, but for those metrics that are not possible through just pulling claims, providers for ADHD are asked to enter information into the AHIN portal. So each metric that's linked to payment is going to have a quality threshold that providers must meet and exceed in order to participate in gain sharing. Risk sharing is not dependent upon the quality information being put into the portal, but in order to participate in that gain sharing, providers have to meet those quality thresholds on all those performance metrics. And they also need to fully report all data on those metrics. So you don't need to leave anything blank when you're going in and reporting your quality metrics, because if you leave information blank on the quality metrics, then that's not going to count towards your threshold. So the next slide that we're going to look at, I think all of you who've been in an ADHD presentation or any presentation have seen this before. And this is kind of the distribution in order from highest to lowest of average cost across all providers. And this is just kind of a mock-up of that. And so it just gives you some idea about where providers stand in terms of performance. So above the acceptable threshold are those providers who would be required to share in the cost, and that's based on your average episode. So it's not just a single particular beneficiary, but you're looking at all the beneficiaries that you've treated to get your average episode cost. So each of these is an individual provider. When you go below the acceptable threshold, from acceptable down to commendable, and that's represented by those bars that are in the gray, then those providers would neither gain share nor risk share. They would neither share in any savings nor would they share in cost. So that's between acceptable and commendable as you kind of go down. When you get into the green, the first green, between commendable and gain sharing, that is where the providers will share the savings based on the cost. So those are average episodes, and the green is going to be a shared. And remember that that's based on you meeting your quality threshold. So it's really important. Like, I know that there's lots of questions about why should we put the quality metrics into the portal. Well, one of the reasons is if you come into this within the green, then you're going to have an opportunity to share in those savings, but you won't be able to do that if your quality metrics haven't been entered into the portal and you don't meet those thresholds. And then there's no incentive for people to go below that gain sharing limit because there's no additional there's no additional shared savings beyond that point. So let's talk a little bit about episode entry and exit. So if you have a client who comes in who does not have or has not had a previous ADHD episode, so they're coming in, then that ADHD episode is initially going to be triggered by two claims with an ADHD diagnosis, and it starts at the date of that first claim. So that first claim is going to be submitted, and then it's going to look for that second claim, and when the second claim is found, then the start date is going to go back to the first claim that was submitted. And so this is also ADHD without the presentation of any comorbidities. So what they're looking for is the same comorbidity does not appear 2 times in the claim history for that beneficiary. So looking at episodes ends and continuations, so there are 3 different ways that episodes end and or continue. First of all, an episode will end when if you have treatment that stops. So if you see a beneficiary for a period of time, that episode's triggered, and you see them for a period of time, and then treatment stops, that episode's going to continue for 365 days, and then it will end. So that it's triggered by that second claim back to the first claim, and then it's going to run for 365 days. Even if, say, it's 6 months in, that beneficiary has recovered or remitted, and they're doing really well, and they're not getting treatment during that period of time. So, or treatment continues at level 1. So they there's an episode that's triggered at the end of 365 days. There's another claim that's going to trigger that second episode for them. You're going to complete that continuing care certification. This new ADHD level 1 episode is going to begin at that point in time. So you've got one that's run for a length of time, and then you're going to do a continuing care certification and just continue treatment as you are. Or the provider completes an ADHD continuing care and a severity certification for level 2. So you have a beneficiary who is in treatment for at least 60 days, and at the end of 60 days or sometime thereafter, that beneficiary meets the requirements to move to a level 2 episode. So at that point, if you are the treating provider for episode 1, you can do a severity certification. That's going to be date stamped, and then that's going to end your level 1 and going to begin your level 2 certification. If you are referred that beneficiary by a PCP, if you're a provider, a licensed clinical psychologist, or someone, and that beneficiary is referred to you from another provider who's been seeing them, or you pick them up, then you would do a continuing care certification, and then you would complete that severity certification in order to escalate them to level 2. Still, there's going to be that 60-day requirement, and we're going to talk a little bit more about that after a while. But a partial ADHD level 1 episode will only be counted, as Paula told you earlier, on the basis of whether or not that episode lasted for 120 days or longer. If it did not last if it lasted for less than 120 days, then that partial episode is not going to be included. And there are no partial episodes for level 2. Once the beneficiary is in level 2, they remain in level 2 for the 365 days. So there are 2 severity levels for ADHD clients aged 6 to 17. I'm just remembering that it's age 6 to 17. So if a beneficiary comes into treatment when they're 5, if you're an RSPMI provider, while they're 5, that will require prior authorization. And the trigger claim will be after their 6th birthday that'll start that ADHD episode. If there's a claim that's submitted while they are 17, that episode will run for 365 days. So it doesn't stop on their 18th birthday. It will continue to run for 365 days if the episode started while they were 17. So clinical guidelines are centered around evidence-based programs, which Dr. Miller has talked about, that include some behavioral and medication therapies. The episode length is 365 days unless a level 1 episode is terminated through that escalation by that severity certification and possibly a continuing care certification to level 2. And it begins at the first date with a primary diagnosis of ADHD, that first visit. And to qualify as an eligible episode for gain sharing, there has to be at least 90% compliance with those certifications, completions, and submissions. And remember, we talked about that you have to answer all of the questions that are on those certifications. Incomplete certifications don't meet that threshold. PAPs are going to certify that they've completed some appropriate assessment and certifications, including the use of guideline concordant assessment and reassessment and diagnosis, treatment planning from the beginning of episodes for new clients, and also that there's a submission of a severity certification for level 2 treatment. And for those clients with an inadequate response to current or past treatment episodes, the PAP must submit a continuing care certification at the beginning of the next episode or before the end of the next episode. They're going to submit that continuing care certification after the episode end when treatment continues beyond that 365 days. So level 2 and partial episodes. Let's talk about them for just a little bit. So a level 2 certification has to be submitted through the provider portal. And once that valid certification is received, then an ADHD trigger has to be identified through claims data to actually start that episode. A level 1 partial episode is created when a level 1 episode is shortened by that level 2 episode. The level 2 certification has to be submitted after the first 60 days of a level 1 episode. If it is submitted prior to the first 60 days of that level 1 episode, then that level 2 certification is not going to be considered valid. So there's that 60-day restriction that that beneficiary needs to be in level 1 for 60 days prior to an escalation to level 2. A partial level 1 episode will only be created if that level 1 certification occurs more than level 2 occurs more than 120 days into that episode. So 120 days, 121 days, then that's going to create a partial episode, and what Paula said is that that's going to be prorated and included. In order for an existing level 2 patient to directly enter a second level episode, a provider has to enter a new severity certification within 30 days on either side of that original episode end date. So that would be 30 days prior to that end date or within 30 days of that end date. If that certification is not entered within 30 days, one on one side or the other of that, then that first claim is going to trigger, after that 30 days, that first claim is going to trigger a level 1 episode. And so at that point, then you would need to wait that 60 days, and then you could escalate them to level 2. So it's really important that you get those severity certifications in within that period of time when you look at those end dates on your episodes. This is just kind of some examples of some time frames in terms of partial and level 2 episodes. In that first example, what you see is the red X. That red X was before the 60th day, so that level 2 certification was received prior to day 60 and was invalid. So that red X is like an invalid severity certification. In the second example, you've got a level 2 certification that was received after 60 days and was therefore valid. But what you also see, if you kind of look down at the bottom where it says invalid level 1, invalid level 2, that episode the level 1 episode was less than 120 days. So that first, say 70 or 80 days that was in that level 1 episode, that was not long enough for that to be a partial episode, so that's an invalid level 1 episode, and you're going to begin your level 2 and go for 365 days. On your next example, what you see is there's a level 2 certification that was received after 120 days of that beneficiary being in level 1. And therefore, you do have a partial episode for level 1, and that's valid because it's beyond that 120 days. And then you'll see that because it was past 60 days, you now have a valid level 2 episode as well. And then any new Level 2 certification that was received during the 60-day grace period, and that's 30 days prior to and 30 days after that episode, is going to be valid. So in this particular case, between day 365 and day 395, you see that there was a Level 2 certification that was submitted on an episode that was ending. So that's within your grace period, so therefore that would be a valid Level 2, and then you would continue for 165 days. And say if that had been done in any of the white period before that grace period or any of that time after that, before that it would have been invalid, and then after that, after 30 days, remember that would then, there was a claim submitted in there, that would then trigger your Level 1 episode again. So certification is required for quality assessment, severity certifications, and for reoccurring episodes. So over on the left-hand side, what you're looking at is those different kinds of assessments that you're going to find on the AHIN portal. So the first of those is a quality assessment certification, and that's for all clients who are new to care. So right now, if you've got someone who comes in, they're new to care, they're new to you, if they tell you that they haven't been in care before or you're not sure about that, then go ahead, you need to enter a quality assessment. Don't ever assume that anyone else has entered an assessment, and even if they have, that it's going to count for you. You need to do your own entry into the portal. So you can enter a quality assessment for clients new to treatment. It's completed after the assessment to initiate treatment, and it's completed by the PAP or who's delivering or is going to deliver care. And it requires that PAP certify the completion of certain guideline concordant assessments and that there's no comorbidities, and of course it's going to encourage that there is thoughtful and high quality assessment throughout that episode and throughout the treatment of that client. The severity certification, Level 1 patients who require higher level of care, or for those patients who are recurring in a Level 2 severity. So it's completed at least 60 days since the Level 1 episode started, or as we looked back in that gray area, it's completed at Level 2 episode recurrence in that 60-day grace period. The PAP is going to certify that patient presents a higher level of severity, and again, that's going to encourage a thorough assessment for that need for Level 2 treatment. The continuing care certification is for all recurring ADHD clients within that episode model, and it's completed at recurrence of the episode model, completed by the PAP, and again, it's going to require certification of adherence to some basic kind of quality care measures and guidelines to reassess for ADHD without comorbidities to ensure that they belong in that ADHD episode, and encourages evaluation and reevaluation of effectiveness of care. This is kind of what you're going to see or what you're going to answer. This is the quality assessment. Basically, it's saying that you certify and attest that there's been a diagnosis, that there's been documentation of a vision and hearing test, or that it was confirmed that it was completed by a qualified provider. There's a diagnosis in person, reports at least 2 settings. You've got your basic criteria for ADHD. The screening is for comorbidities with a broadband diagnostic tool of some type, that you've attained all that history. And then that either you're the patient's PCP or that you've alerted the PCP. Really, there's a need for there to be this consistent kind of coordination of care and communication between all providers who are treating these beneficiaries, the PCPs and other providers such as clinical psychologists or RSPMI providers. Your severity certification is going to be to escalate beneficiaries to Level 2. There has to be 60 days before it can be completed. And you're stating that there's been an inadequate response to the guideline concordant medication management, and that further treatment is clinically necessary for one or more of the following rationales. So there's that marking one of those, at least one of them, in order to escalate them to a level 2. And then the last that we're going to look at is the continuing care certification, and that's after an existing episode ends. If you're beginning to see them for the first time, you would do a continuing care if you knew that they were already in treatment, the episode was already going on, or you would do a continuing care if you're beginning to treat them at level 2. So you'll do the continuing care and then the severity certification if they've been in care more than 60 days. Another reminder is that an episode may not begin with you. An episode is going to begin with the first provider who's providing treatment with an ADHD primary diagnosis with no comorbidities. So that's tracked at the beneficiary level and not at the provider level. So it's really important to remember that the episode may have begun before you see that beneficiary and already be in process. So you would do the continuing care certification if you knew that they were already in treatment. And then you would continue either with a severity certification or just continuing to see that beneficiary at level 1. Reporting metrics assessing quality and utilization are going to be tracked for provider feedback and gain sharing eligibility. On the right-hand side, what you see is the quality metrics that are linked to gain sharing. And as you see, there's a checkbox only in one of those. That's 90% of episodes with completed certification, and this is for the ADHD episode. You also have some quality metrics that are being tracked, such as the percentage of episodes classified as level 1, those where you're certifying non-guideline concordant care, non-guideline concordant rationale, the average number of physicians visits per episode, and the number of episodes with medication. You're also going to see on your reports the comparative data for that, so that's going to let you know where you stand in reference to the average of all providers. So I think that's some good information to look at on your reports to see where you stand. And I'm going to turn it back over for the last part to Ms. Paula Mueller.
Thank you. So, when are we going to get the next ADHD report? You will receive your first performance payment report at the end of April. It will include claims that are filed through January 1st, 2014, and it will include closed episodes from the first performance period. In other words, the episode end dates from October 1st, 2013 to December 31st, 2013. You will only receive the performance payment report in April. You will not receive an informational report. The next report you will receive is the end of July of 2014, and it's for the performance period 2. And in performance period report 1, performance period 2, report 2, you'll get the end of October, and so on till we get to the end of April of 2015 when you will get your second payment performance report. The 3 that you get in July, October, and January are going to have open and closed episodes from the second performance period from January 1st, 2014 through December 31st, and it's going to include detail on level 1, open, closed, partial, level 2, open, closed. It's going to have types and number of exclusions, so you'll have a lot of information in those performance reports. The next slide, please. So what do you need to do now? You need to look at your ADHD reports. They should arrive near the end of April. You need to look over your payment report, check to see if your average episode cost makes you eligible for gain share or subject to risk-sharing payments. And very important, you need to enter your portal data. Fill in the details about your client's episodes on the provider portal, assessments, and severity certifications.